Good evening. My name is Shane Lucero, and I'm presenting Project Uplift, which is a proposal to create an outpatient mental health telemedicine program in the state of Arizona. So, table of contents here. Briefly, I'm going to try to discuss the background for this project, introduce the project, give a description of Project Uplift, talk about how I'm planning on implementing this project, how I plan to measure success of the project, obstacles I foresee that would prevent success, and then just kind of a conclusion based on the proposal. So without further ado, a little bit about background. So in 2018, the State of Mental Health in America report indicated that 56% of American adults with a mental illness did not receive treatments in 2017. And over 1.7 million youth with major depressive disorders didn't receive treatment in 2017 either. So many variables can contribute to those statistics, but access to mental health care is certainly one of the driving factors. Residents of Arizona should be especially concerned, as Arizona is reported to be the state with the second lowest access to care in all 50 states. So access to mental care is an issue that needs to be addressed. So introducing my project. So Bright Start Telehealth LLC proposes the creation of a mental health telemedicine program called Project Uplift that will endeavor to increase access to mental health care in the state of Arizona. So the vision for Project Uplift is that Project Uplift will become a self-sustaining telehealth program that will increase access to mental health care in Arizona. It's going to be a provider to consumer synchronous telehealth solution. So we're looking to be interacting specifically with patients. So initially, this is going to consist of a pilot project in 2 primary care practices in Tempe, Arizona. So Bright Star Telehealth is partnering with these 2 private primary care practices in order to implement this. So the Project Uplift team will consist of a psychiatric mental health nurse practitioner, as well as a certified counselor, 2 kind of care guides, and then 2 registration/billing specialists and an IT consultant. So with this plan, patient engagement can take place anywhere. The patient has safe access to web and video. If the patient has no safe access to web and video capabilities, arrangements will be made by the Project Uplift team so that a care guide with a secure tablet can meet the patient at a safe location so they can start receiving mental health services. So how does the patient get in contact with? And so Uplift will rely on primary care providers and partner with them. So the primary care providers will identify patients who would benefit from the mental health services offered by Project Uplift. So they will go ahead, the primary care providers will initiate an office mental health telemedicine consult utilizing Project Uplift's secure web-based video telecommunication program on their laptop. The primary care provider will perform a warm handoff to the Project Uplift nurse practitioner. And then the nurse practitioner will kind of do a kind of initial assessment and then set up initial assessment, brief triage, gather required registration financial information. That part could be completed by either the care guide or the billing specialist, and then of course schedule follow-up. And the Project Uplift team will be following up with the patient, providing mental health services to the patient who presents there, and the patient won't need to be in the primary care office any longer to interact with Project Uplift. So a little bit about project implementation. So we have a brief timeline And so basically, one of the first things that we need to do is determine budget. So the first year operating budget is in the proposal, and so there's definitely more detail about that there, but would involve cost of office space and utilities, cost of staff, including that psychiatric mental health nurse practitioner, the licensed professional counselor, the care guides, the billing and registration specialists, the IT consultant. Also includes cost of liability insurance, such as malpractice and business liability, cost of an EMR program, also costs for any kind of locum practitioners that would be needed should one of our practitioners or counselor need to go on a vacation, what have you. Also cost to funding to secure the actual telemedicine program, which we selected Zoom to utilize Zoom, and so there's a cost associated with that, and so we budgeted for that as well. So all that'll be kind of in that first year budget. And so there's in the proposal as well as there's detail regarding how we came to choose Zoom as the technology choice for delivering Project Uplift. So once first year operating budget has been determined, which was determined and comes in around $600,000 for the first year. So Bright Star Telehealth will gather and provide that initial capital. So that'll be private funding from Bright Star Telehealth. And we'll go ahead and work on securing office space shortly thereafter, hiring IT consultant, and building out secure web-based video teleconferencing platforms. That will just be kind of making sure that all our technology works well together, the Zoom, our EMR, our our physical hardware. We'll go ahead and hire and train remaining staff there in November, December is the plan. Coordinate with the primary care offices to start the project up January 2019. So that pilot project, that proof of concept, will run from January 19 to January 2020. Beginning in August, we want to start to analyze the available data to demonstrate proof of concept and create a proposal to take to investors. So we're going to seek out investors in October, hopefully, so that Project Uplift can continue to operate and expand without any kind of break in services. Once additional funds have been secured, we're going to seek out additional primary care offices to expand the telehealth program too, likely in December of 2019, and then we'll roll right into year 2. And thereafter, we'll do evaluations on a yearly basis. So that's kind of a rough timeline of what we'd be looking at with the rollout of Project Uplift. So how will we measure success with Project Uplift? The big thing to measure success, we're measuring 2 things because that's part of our vision. Measuring access to mental health care is obviously one of the biggest ones, and then financial sustainability. So it's great if we improve access to mental health care, but if it's not financially sustainable, then it's a solution that won't be able to continue. And obviously, we want our solution to be able to continue on. So we want to be able to be financially sustainable. So one of the things that we'll be measuring is the number of patients enrolled and receiving care. So this will help us to address actually both of those items. So number of patients enrolled and receiving care. Our project proposal shows about how much money we plan on charging per patient for initial visit and then for follow-up visits. So number of patients enrolled and receiving care kind of helps us determine whether or not we're going to be financially sustainable based on kind of factors into that annual income to expense ratio. So those 2 things kind of help to determine whether or not we'll be financially sustainable. Also, the number of patients enrolled and receiving care helps us to measure how we are basically increasing access to mental health services versus a brick and mortar office. So we'll kind of have that data there, as well as the type of patients that we're addressing. National ranking, so that is kind of more of a long-term goal. We have it plotted out, maybe measuring at year 5, the impact of Project Uplift on Arizona's national ranking as far as access to healthcare, mental health care. So the nice thing is that it's hard to go much lower than 48. So we hope that we can make an impact, and realistically, we hope to increase it by at least 10% the access by 5 years. So hopefully we'll be able to get a little farther along, a little closer to 40 at least. Optimally would be in the top 50%. So I'm in the middle of the video there. So obstacles to success. So one of the biggest obstacles we see would be funding issues. So Brightstar Telehealth LLC is pretty confident that it can get the $600,000 of private funding initially. But then year 2, likely Project Uplift would still not be financially sustainable on its own, and so would require additional investing from either Brightstar Telehealth or outside investors. So definitely funding is going to be an obstacle for the program to be successful. And so ways to overcome that. So after proof of concept is established, kind of in that, hopefully in that October of year 1, Brightstar Telehealth will go ahead and approach interested investors and innovators and venture capitalists with hopes of securing funding to kind of make it through year 2 in order to be, and at that point, by year 3, hopefully it'll be financially sustainable. Additionally, we could consider an IPO, but I don't believe that that's a viable option at this point. Another barrier that could be a barrier to success would be buy-in from providers. And so one thing that Project Uplift will do to address that barrier is to provide some educational opportunities for primary care providers to learn about the effectiveness of providing mental health care via telemedicine, because maybe there might be some maybe reserve from the providers about referring to a provider who's delivering services that's not in a brick and mortar setting. And so definitely there'll need to be some education that Project Uplift will provide to the primary care providers. Also, we plan on having the care guides in the actual primary care office during the first month of project implementation, just to make sure that everything is as smooth as possible and that any physician questions or issues that arise can be handled in a proper manner. And then patients' comfort with technology / patients' access to technology. So Project Uplift care guides are also going to be responsible for kind of helping educate patients about how to use the technology, so use Zoom, and then maybe help those who don't have access to the necessary technology, basically to make that possible. And so they would have to maybe do some outreach to those patients who don't have those means of interacting via technology. So that could involve care guides going to the actual patient with the appropriate technology, like a secure tablet with video capability, video and sound capability, and Zoom uploaded on there. So that's definitely something we would consider to overcome that barrier. So in conclusion, Project Uplift is an important undertaking by Brightstar Telehealth to meet the need for increased access to mental health care in Arizona. Thank you guys for taking the time to view my slides here. There's a little bit of my works cited page for the PowerPoint presentation. Thanks.